Mr. Leon Pereira.
So, as we've described in previous responses to parliamentary questions, Trace Together and Safe Entry continue to play important roles in our pandemic response system. Trace Together and Safe Entry enable verification checks into venues or activities where vaccine-differentiated safe management measures, VDS, are enforced. And this is necessary to protect unvaccinated persons who remain at higher risk of severe disease. We aim to keep rules and requirements simple, and we regularly review the need for these. We will continue to rationalize and simplify our safe management measures.
Mr. Pereira.
Thank the SMS for his answer. Just one SQ. Given that the compliance burden for Trace Together and Safe Entry is not insignificant, it affects time, productivity, etc. What would be the criterion or criteria that the ministry would use to make the decision to kind of phase it out? At what point will that actually happen? Thank you.
Thank the member for his question. Indeed, measures that affect public health and safety do have a compliance burden, and this is not unique to Trace Together and Safe Entry. Neither is it unique to the COVID-19 situation. If you look at, for example, the automobile industry. I mean, the use of seatbelts is a cost burden, but we all do it now after many decades of education because it's proven its worth. So really the issue is whether or not the approach that we're taking has proven its worth. I hope the member will agree that it has the ability to issue health risk warnings and notices very quickly in the face of a rapidly progressing epidemic or pandemic is an important public health measure. And these have managed to keep our case fatality rate low as we've slowed the spread and allowed people to self-isolate and seek help very early on in the illness. So as long as we are able to do that and to demonstrate an effectiveness of using Trace Together, Safe Entry, our vaccine-differentiated measures in our public health response, then I hope the member will agree that the ability to save lives, prevent morbidity and mortality through this disease is an outcome, a beneficial outcome, and it's worth paying that compliance cost and compliance burden for. Studies in other parts of the world, there's a UK study that was published looking at this, looking at some modeling at the extent to which this contact tracing approach, an automated contact tracing approach, saves lives, prevents cases, and we have every reason to believe the same is true here in Singapore. The study that was done in the UK, if we extrapolate that approach to our situation here, the estimate is that between September 2021 and January 2022, comparing similar data sets over about those 4 or 5 months, the contact tracing approach that we've taken in Singapore may have saved about 290 deaths and slowed down the progression to avoid about 144,000 cases. And I hope the member will agree that these are useful outcomes. When will we no longer need such an approach, and when will we phase out what the criteria may be? It's a bit too early to tell. We need to wait until we no longer need vaccine-differentiated measures. We need to wait until we're quite sure that the pandemic and COVID-19 is no longer epidemic, but is endemic. And we have not reached that point yet. It's very hard to say with some degree of certainty what that date will be. But I think we've explained before that as long as we need those measures in place, the public health measures, the vaccine-differentiated measures, then today the easiest way and the least burdensome way and the cheapest way for businesses, for us to roll out these measures, is to continue with the trace together and safe entry systems that we have in place, rather than standing up a whole new system and a whole new infrastructure in order to get those outcomes. So when we no longer need those measures, then we will stand down the system.